Dear Thom, I've been meditating for over a decade and have experienced enormous benefits, including improved mental health. However, I have recently been struggling with heightened anxiety in a way that feels very physical, like my nervous system, spine, thighs, neck are all lit up with electricity. This has led me to contemplate taking anti-anxiety medication like Zoloft or Prozac in hopes it might improve my symptoms. But there's a part of me that sees this as some failure of me as a meditator. I worry that by getting on a medication like this, I could be, quotes unquote, throwing away a decade of time spent managing my mental health the natural way, with meditation. Any thoughts or guidance is much appreciated.
There's absolutely no shame in receiving help. One of the things meditation is supposed to do for us is to make it clear, first of all, that we cannot white-knuckle it into, perfection. And one of the things that meditators are supposed to do is to be more intelligent about reaching out and getting help. You don't have to do everything on your own. And if part of the help is the tactic of taking medicine, then if it's prescribed, and I don't recommend non-prescribed medicine, but provided that it's prescribed, there's no shame in it, and you can't lose 10 years of evolution. When we have established that much level of being, sometimes the stresses that are in our physiology cannot stand living in a physiology where the consciousness is becoming more and more pure. And so the stresses are being removed from the body. But that process can sometimes also be very challenging. And I don't see taking prescribed medicine as a strategy. A strategy is, I grew up under a general, so I know all these words very well. Strategy means, the consistently applied program for achieving an objective. That's what strategic and strategy means. Tactic is the thing that you do when the strategy needs help. When the strategy isn't meeting all of the demands, then you bring in tactics. And a tactic is something that you cannot use as a strategy. You can't live your life as a tactic. You have to have a strategy. And the tactic supports the strategy. So in the case of medicine that we get from a doctor, the tactic will be to give you the degree of calmness and settled, keep your meditation going twice every day, and make sure our practitioner knows that we do have a daily meditation strategy, and that we're not like their other patients who don't have a strategy. And we would like to look into, in a graded fashion, researching the gradual decrease of the potency of the medicine. And most practitioners will admire you for this, that you have a strategy to come off of dependency on the medicine. But while that dependency is there, don't take shame in it, take pride in it. We need to take pride in the fact that we actually reached out for help and we're doing something as well as meditating. We're doing something to help ourselves and to come through in a triumph. Prescribed medicine cannot take away how much pure consciousness you've established yourself in. It cannot do that. It doesn't have that power. You're established in being. Think of cosmic consciousness as being in percentages. We start off with meditation, maybe we're 5% established in being and 95% not. And then a year or two goes by and we get up to 35%. Just say, could be different for different people. And then we keep meditating and we get up to 50%. cosmic consciousness. 10 years into meditation, probably we're hovering around 75%. And those habitual behaviors of the physiology to go anxious are easy for you to see now because you have 75% establishment in being. And so talk to your doctor, get their best advice, go with that. You're not going to go backwards to, 30% or 5%. You can't go backwards in evolution. Devolution can't happen. It doesn't happen. And so let's get better. And, as we're getting better, we take a graded approach along with our practitioner. We take a graded approach to reducing the amount of medication until eventually it's a non-therapeutic dose. That's what a practitioner is looking for. Before they'll take you off of a prescription, they want to reduce it down to what's considered to be clinically not even a therapeutic dose anymore. You're taking such a tiny percentage of the medicine, there's no way that it could actually be having any effect on you. And you're looking stable. So then they can remove that last little trace of it. And you're back to practicing your meditation and getting your brain self-sufficiently to generate all the chemicals that it needs. But meanwhile, you're to be congratulated for following my advice. That's my advice to people. Doctors are not bad people, and drugs that they give you are not bad things. We need to get out of that mentality. I've seen a lot of people make themselves much worse and crash and burn because they thought, I'll meditate and that'll be the end of everything. I'll just meditate my way into cosmic consciousness, and it may not be possible for everybody to do that. I haven't had to take any prescription drugs, but if I had to, I'd take them right away, yum yum. No problem. I'd be delighted to. You don't take them because they make you feel worse. You take them because they make you feel better. So, follow the advice of your doctor and keep meditating. And be sure your doctor knows that you're meditating. It'll make a difference in the therapeutic strategy.